Back at the Naturopath. Thanks for coming back to my channel. Before we jump into this video, don't forget, at the end of the video, you can download some free resources that I've created just for you. The Candida Diet and Cleanse Starter Guide, the Ultimate Candida shopping list, the diet shopping list, and also the Candida Symptom Tracker, which you're going to find very useful. So these are all for free. So at the end of the video, just jump into yeastinfection.org/goodies and you can download these things at no charge at all. If you have any questions, remember you can always ask those and either I can get back to you or the team. So thanks for tuning in and we'll catch up with you at the end of the video. Greetings and more. You know what? Eric Bakker here, the naturopath from Down Under. Here's an interesting question. I've got irritable bowel syndrome, high histamine and inflammatory pain. Should I take CanXida products? Well, as you know, I call IBS a garbage can diagnosis because it's where doctors put people into when they want to get rid of the problem. They put them in the can, put it out the door, hopefully someone's going to take the can away and deal with it, right? Irritable bowel syndrome needs to be understood in terms of what the hell is underpinning this. So whoever wrote this question, I would love them to have a comprehensive stool test and have a good look at all the bacterial, yeast, parasitic profile. We can look at inflammation, immune markers. Everything needs to be checked out carefully. We need to know what the hell's going on, okay? So it's a bit like we've got a criminal. We've got a guy here called Mr. IBS. Doesn't it make sense now that he's been busted with like naughty things on his laptop and all the crazy things that some people do? Doesn't it make sense to go back to his house to see where the guns are and the bombs and all the ransom notes and all the stuff? We need to check this guy out. We need to talk to relations about him. We need to really work out if this guy's going to be, what are we going to do with this guy? How can we fix him? What's his background? We need to make inquiries, okay? So people like me tend to be like I think they call them the feds in America, the federal people in those black suits with the sunglasses on. They ask questions. They got microphones in different places and stuff. So they're always nosy. They want to know. They want to get to the bottom of it. You need to get to the bottom of this problem, IBS. There's no point in just saying, should I take, It's not really the way to do it. If you want to get to the bottom of it, comprehensive stool test. Maybe even a breath test, but I'm not really that convinced that breath testing is any good for SIBO any more than not breath testing. I still believe that comprehensive stool test through doctors' data in Chicago. Is it Illinois, Chicago, or Chicago, Illinois? I can't remember what's the state and what's the town. So inflammatory pain is making me believe you've got some Citrobacter there or Klebsiella or some bacteria that are being pretty darn naughty and they need whipping into shape. So high histamine levels could be many different reasons for that, but you need investigations before you take CanXida Remove, okay? Just like that guy needs investigations, like on a deeper level. The more serious the problem, the deeper the level of inquiry should be, and the more thorough until you go, aha, I've got the light bulb moment, okay? And I've had so many light bulb moments with so many people looking at stool tests, and it was a turning point for the patient. Do the work properly to get the best outcome. Your health is priceless. $300, $400, $500 for a test is a drop of water for the average person. Yet many people say, I can't afford this test. I can't afford it. On their way to Wendy's or McDonald's or, on their way to booking a Hawaiian holiday, but they can't afford the test. I know it's expensive, but being sick for years is far more expensive. IBS cases can often be fixed up within 12 months when you've got the right information under your nose. IBD is a different animal altogether, inflammatory bowel disease, all right? But IBS can turn into IBD. IBS can turn into stuff I didn't want to talk about. So it's good to get to the bottom of it, all right? Don't worry too much about all the bits and pieces. Get the stool test done and find out what's happening and see a good therapist so you can work along that person, get the right kind of advice and clear this beast up. CanXida products will help, but I think it's good to get the intel first before you go further. All right? Find out what's the right gun and bomb to use, and then let's let it loose in a controlled fashion, because we don't want to wipe everything out. Right? And that's why antibiotics are no good. Antibiotics, it's like those American planes, they come in, those warthogs, I think they call them. They just destroy everything, all right? And you don't want to destroy stuff, left, because IBS often means that the gut's on a turning point. So get the stool test done, let me know. Thanks for tuning in, and I love the question. It's Eric Bakker again, the naturopath. I hope you enjoyed that video. Remember, go to yeastinfection.org/goodies if you want to download my free resources I've created just for people like you. These are things I used in the clinic for patients, and you'll find them very useful. It's the free Candida diet, the cleanse, so it's a good introduction on how to set your program together. There's the ultimate Candida diet shopping list, and there's also the Candida symptom tracker. yeastinfection.org/goodies. Thanks for tuning in, and subscribe. Thank you.